It hasn't started yet. There you go.
Good morning, Anne Arundel County. I'm Nancy Schramm in the Office of County Executive Steve Shu. Today is our second of a 5-part Facebook Live series on the opioid and heroin crisis impacting the communities in Anne Arundel County. I'm here today with Kesha Brooks, Prevention Education Specialist with Pathways, Anne Arundel Medical Center, and David Stoop, Delphi Behavioral Health Group, Director of Operations, and also the founder of Maryland House Detox, which is going to be opening by the end of 2017 in Linthicum. So thank you so much for coming in this morning and talking with us.
Thank you for having us.
So let's begin with treatment in Anne Arundel County and the state of Maryland. How are we doing? What treatment options are available for our residents seeking treatment for mental health and or an opioid heroin addiction?
Did you want to take that one?
Sure. So we are actually expanding services in Maryland, which is a very good thing. We've had all levels of care available, and for people who don't know, there are different levels of care where we can treat addiction, alcoholism. There's outpatient, there's intensive outpatient treatment. Then you have your residential and partial hospitalization, more intensive stays, and you have a detox stay as well. And a lot of times what we do as professionals is try to string those resources together to get the most intense level of care and the longest treatment engagement that we can. The longer that people are engaged in treatment, the better. So the resources here in Maryland are growing. We have more residential treatment centers opening up. We have more access to detox services with Maryland House Detox opening up. Here in the county, Anne Arundel County is actually pretty lucky. Here in Anne Arundel County, we have probably more services than a lot of other counties in the state.
Great. And Pathways, what services are available at Pathways?
Well, we have our inpatient services. Of course, that's to help sustain your abuse disorder. And then we have our outpatient services, which intensive outpatient therapy. Then we have our levels of continuing care, which can consist of at-risk programs, education programs. We have Al-Anon, which is at our facility at Pathways on Thursdays at 11 a.m. And
So it's one thing to assess someone for treatment. What about the family? Or what services are available for the family?
So a lot of treatment programs have additional family services. And we always recommend that the family actually seek those services or become engaged in those services with whomever it is seeking treatment with that treatment provider, right? So that way you can become involved in your loved one's treatment because this doesn't affect just the individuals that are addicted, right? This is a family disease. And families have to come together. We have to become educated on how to help our loved ones. Also, how to help ourselves, right? It's very important that we learn how to help ourselves. And in addition to, I think maybe you can touch on Al-Anon and some other community support services. I always recommend that families seek engagement with the treatment provider, right?
What about, I hear a lot about Al-Anon, what about Alateen?
yes, there's an Alateen program, and that's a program where teenagers can come together in a support group to help each other through a family member suffering with a substance abuse disorder. At Pathways, we also have the Family Wellness Workshop, which involves the family members, because substance abuse disorder is not just a disorder where you as an individual who is suffering from that disorder is the only one suffering. You have the entire family. Anyone who loves you, anyone who touches you, anyone who's in your life is also suffering with that disorder as well. So the Family Wellness Workshop helps you to just to understand the whole process of the disorder and what your role is and your responsibilities are, and just how to get through it.
Well, back to treatment. A lot of folks preach abstinence versus using other medicines. Is there a right treatment?
Treatment should be 100% individualized. We have, every day there's new science that is coming out, right? I think this is a multifaceted approach that we all have to take, and I think everybody needs to be open to all of these approaches, right? There is not one way to treat this disease, and whatever course of action a treatment provider, an experienced treatment provider takes, needs to take into consideration past history, current living situations, any comorbidities like mental health issues, those types of things in developing a treatment plan. As far as abstinence-based treatment is concerned, there is a school of thought that we can do better than somebody having to take a medication every day, right? But I guess the biggest part of the debate is, how do we get there? How do we stabilize people who have been affected by the disease of addiction, who have been using drugs and alcohol for numbers of years, every single day, right? How do we most effectively move that person towards a happy and healthy life, and whether that means taking something every day or not? I will say this, is that any medication-assisted treatment needs to be coupled with treatment and therapy.
Definitely.
And there needs to be accountability for any medication-assisted treatment that does not offer treatment and therapy.
Yes.
You can't have one without the other, and I think that's where a lot of there's some misunderstanding that somebody can just go somewhere, go to a doctor and take a pill and poof,
Right.
I'm better, and that's not how this is. So if medication-assisted therapy is used as treatment, there has to be accompanying support there. And it's not just, you can't just take a pill. You can't take a magic pill and this be solved.
I totally agree, because substance abuse disorder is in correlation with mental health. So they both have to be treated. You can't just treat the substance abuse and not know mentally where you're going to be in the next step.
Kesha, can you define mental health?
Mental health, it's just the process of getting your mind in order, basically. Basically.
So mental health can be depression.
Oh, yes, depression, anxieties, stressors. There's a whole lot that goes involved with the mental health.
So for the treatment programs that are available today, are they supported by scientific evidence? What, how do we arrive at what works and what doesn't work?
Yeah, actually, I was researching the scientific aspects of substance abuse disorder, and NIDA, National Institute of Drug Abuse, has done a survey, and they surveyed about 62 treatment facilities and the patients that go into those facilities to see how the process of the treatment centers are working for them, and is it a longevity type thing for them. And the end result was very positive, but it's not. Substance abuse disorder is also a brain disorder, so it's not something that's going to happen overnight. It's not something that where you can go into a treatment facility and expect that this first time is going to be the only time. There is a high percentage that you may need continuing care, that you may need to go through something more than once to get. You have to go through it to get through it, and that's basically how it is.
And I'd like to expand on that as well. Any time that there's an opportunity for an intervention, and I don't just mean like the intervention that you've seen on TV. Any time that there's an opportunity for a clinical intervention where we can stop, slow down the progression of somebody using, whether it's opiates, whether it's alcohol, whether it's benzodiazepines, any substances, any time that there's an addiction, if there's an opportunity for a clinical intervention in some form of treatment, then you're doing a good job, right? And SAMHSA also tells us that, so SAMHSA has measured treatment programs for years, analyzed data. The one factor that we know for absolute certain for better outcomes with treatment is length of time engaged in some type of treatment, right? So speaking to your point where, this isn't, for some people it can be a one and done, right? But it's not a one and done and then there's no engagement in any type of treatment, community support, AA, NA, anything like that. That you have to, and the patient, whomever is addicted, has to stay engaged. And I would say the same thing with the family, right? So length of stay in treatment, whether that is a combination of detox, residential treatment, and then continued care with outpatient after your stay, 100%, that is the one thing that we can tie to better outcomes, is staying engaged. So if you have a loved one who's going to treatment, don't just accept, 14 days in inpatient as that's what's going to work.
So, I'm sorry to interrupt. Carol asked, what is SAMHSA?
SAMHSA is the Substance Abuse and Mental Health Services Administration, and that's basically the federal government's arm of substance abuse and mental health services.
And just to piggyback on what you said, this is a family disease, so not just going through treatment and the continuing care, but also there's group therapies. Pathways offers group therapies where we have an individual family group therapy, or we have the group therapy where the family and the individual that is going through the substance abuse disorder is involved in that therapy. It has to be some form of continuing care. You just can't go into the treatment facility and go through your treatment process of stabilization and then come out and say, this is the end, we're good, I'm good now. It doesn't work that way. You need to continue on with that process.
Which I think we really want to highlight, because a lot of times somebody will go in, they will become stabilized, and you feel immediately better, right? I mean, that's just the natural course of things, and you feel better. And if you have a loved one who's seeking treatment, and after 10 days, 14 days, 28 days, they come out and say, I feel like $1 million, this is it, I'm done. Of course, they're going to feel better, but this is a chronic, progressive disease that needs engagement for long periods of time in order to be successful. We know that.
So there is no magic duration for success?
No. The longer that you're engaged, whether it's, again, individual treatment after residential treatment, intensive outpatient, residential, the longer that you stay engaged through that process, the better chances you have at long-term recovery.
Absolutely.
So,
just sorry to cut you off. Cindy wants to know about the it's so expensive, and there is a cost. There is a cost for treatment. Anne Arundel Medical Center's Pathways actually offers that quality care, and it's at a lesser cost, and we're proud of our services. You just have to make the call and do the intake initially so that we can see where you are and see how we can help you. But
I'd like to ask this question.
Sure.
Since Cindy's saying it's so expensive for the family, and they have a family member that's an addict, can't that person, that individual that needs treatment, apply to Medicaid?
Certain facilities, yeah, you can apply to Medicaid. It's up to the treatment
Isn't that
facility.
an avenue?
That is an avenue. That is
Yes.
an avenue. Do all facilities take Medicaid? That's the question.
All facilities do not take Medicaid, but Nancy, you made a very good point. Is that if you have somebody in your family or somebody that you know that's addicted, absolutely take the steps. If they're uninsured, take the steps now. Take the steps to enroll in Medicaid. We still have an expansion. Enroll in Medicaid. you will be able to access services.
So the parents have private insurance, but they can take their 22-year-old and enroll the 22-year-old in for Medicaid.
Correct. Or they could.
I don't think a lot of parents understand that.
Yes. Or if the parents have private insurance, they can also add their 22-year-old up to the age of 26
Right.
to their policy.
Mm-hmm. Mm-hmm.
Now, all things considered, if that's still an expense that the family can't bear,
Mhm.
absolutely look at enrolling in Medicaid. If that doesn't work, if eligibility doesn't work for Medicaid, there is funding. There are funding through each county in Maryland has funding and has beds available through that funding. So please reach out to your county health departments.
Right.
There is a way, and you know, you might have to do some work, right?
Mhm.
But it's worth it.
Right.
And I believe that you can contact Crisis Response, and they'll also provide you with a lot of resources in regards to how to get funding and how to get into treatment programs.
Right. Crisis response can be that first phone call, and I can give that number. It's 410-768-5522. We also have safe stations in the county, and safe stations is a very easy access to treatment. You can literally walk into a fire department, any fire department in the county, and any police department.
Mhm.
But if you walking into a fire station means the personnel on staff at the time will assess you to make sure that there's nothing, a medical emergency is not taking place, because if there is, they're going to take you directly to the hospital.
Mhm.
But if it's if you're stabilized, they will immediately call mobile crisis for you, and that's where the treatment begins. Mobile crisis comes to the fire station and begins the conversation with the person seeking treatment, and actually holds their hand into the door of the treatment facility.
Mhm. Mhm.
So Daniel's asking us, what's your opinion using Vivitrol as a long-term plan for recovery?
I'll
You'll
take
take
that.
that one.
So for people who don't know, Vivitrol is an injectable medicine that lasts 30 days, and Vivitrol is naltrexone. Naltrexone is used for curbing alcohol cravings, but what it's most known for is blocking the opioid receptors in the brain. So with Vivitrol is essentially used again in conjunction with treatment. What Vivitrol does is when you receive a Vivitrol injection, it lasts for 30 days, and essentially it blocks the body's ability to experience the effects of using opiates. So if somebody were to take Vivitrol, use opiates, none of the pleasure, none of the positive, essentially positive reinforcement that people receive from using opiates, that person doesn't experience it. So we actually utilize Vivitrol. I'm a big proponent for Vivitrol. I think anything that we can do now in this day and age with new sciences, with new medicines in conjunction with therapy, that we can do to give people who are addicted a leg up. Essentially what you are doing is every time somebody receives a Vivitrol injection, you're giving that person another 30 days clean.
So how available is Vivitrol, and as someone seeking treatment, how would I know that that particular facility offers that as a form of treatment?
Vivitrol is widely available.
Okay.
Vivitrol is covered by Medicaid. Vivitrol is covered by commercial insurance. So normally what happens is at the end of a residential treatment stay, right, you can ask your provider for Vivitrol, or when you're calling, you can ask your provider for Vivitrol. You receive an injection prior to leaving residential treatment. So again, what we've done is we've just given somebody 30 days, somebody who had been addicted to opiate. We are just now in that crucial period That's the most crucial period, which is right after residential treatment, where we see people relapse. But also, when people relapse out of residential treatment, that's also when they're highly susceptible to overdose and death, because the opiates are out of the system, the tolerance is back down, and when people are leaving treatment, they think that maybe I can use the same amount that I was just using, and their body is not prepared for it. So Vivitrol, and if your treatment provider doesn't offer Vivitrol, they should at least refer you to somebody who is able to give Vivitrol. You can receive Vivitrol injections on an outpatient basis. You can continue to receive those, and there's no harm. This is not a maintenance drug. This is not a replacement drug. This is simply an opiate blocker.
Okay, so since Vivitrol's been out there and used, on average, how long does that particular person use Vivitrol? Is there at some point where you stop taking that injection?
There can be. I mean, you can use it up to a year, up to 2 years. But normally at that point, we've seen people that are engaged in self-help groups, engaged in their own recovery. You really like to use Vivitrol in those crucial 6 months after treatment.
Let me ask you one question about Vivitrol before we go to the next question. Vivitrol, does it allow you to sustain normalcy, so to speak? Like you will be able to go to work, you'll be able just to do your normal day-to-day activities in life?
Absolutely,
Yeah?
absolutely.
Okay.
This is not a replacement of any opiates. This is
Okay.
not Suboxone. This is not Methadone. This is simply a blocker.
So since you brought up Suboxone and Methadone, David, what are they and what are the differences between the two?
So Suboxone also has the active ingredient in Vivitrol, which is naltrexone, right? I'm sorry, yes. And Suboxone also has a replacement, an opiate replacement. So Suboxone is used in detox settings, right, to facilitate a comfortable withdrawal. Doctors use it, treatment providers use it. We use it to detox people instead of going through a painful withdrawal. Detox you comfortably. Suboxone is also used for long-term treatment. And that's sort of where we get into what we were talking about earlier, which is abstinence-based, medication-based. 1,000% of the time, my recommendation is any use of Suboxone is used in conjunction with some form of treatment or therapy. If not, you're just replacing one drug for another. And Methadone has been around for a very long time. Methadone was essentially the original opiate replacement. So again, Methadone is just an opiate replacement, but you're substituting one drug for another. Right.
Yeah.
And if you're going to use Methadone, please use in conjunction with therapy. Otherwise, you're going to be in the same boat.
So,
Did you want to add?
I wanted to say hi to Jenny. Yeah. Hi, Jenny. So she asked, is it true that there is not a detox rehab facility for adolescents in Anne Arundel County? That is absolutely not true. As a matter of fact, Pathways, we have in our facility, we accept people, adolescents, starting at age 13. At present, we do not have any adolescents in our facility, but that's just due to lack of referrals. Admissions, actually. It's just due to lack of referrals. And with that space, we're just using it for as resources for working with the heroin epidemic right now. But if given referrals, I'm sure we would fill up that space.
And your adolescent program accepts Medicaid?
Yes, for adolescents, yes.
Right, so you accept Medicaid for adolescents, you accept private insurance
Yes.
with adolescents? Great.
Yeah.
So what is the youngest age, Dave and Kesha, that you've actually detoxed at any one of your facilities?
I'll leave this to you?
I really wouldn't have that information. My expertise in pathways is more towards education and prevention. So I don't get into the actual treatment of the patients. I do know that I work with adolescents starting at age 13.
I'll say that normally you're looking at anyone from 12 to 17 for adolescents.
Mm-hmm.
Wow.
Mm-hmm.
Wow.
And that's for detox?
Yes.
Yeah, wow.
So, here's a question from Howie. Can we mention DWI treatment options? We have an incarcerated family member with no insurance.
Yeah. Yeah.
That's driving under the influence, right?
Yeah.
Correct. I'll take that. So, I'm being told that people are having trouble hearing me, so
Oh, okay.
I'll look this way. So for DWIs, there are a lot of providers, and it's actually really easy. You can absolutely call the county. You can also simply Google DWI here in Maryland. Has to be essentially a licensed provider who will provide DUI services. Normally it's a 12-hour course. It depends on the severity of the DUI. It depends on how many times. Is this the first time? Is this the second time? But I also want to say this. A lot of times a DUI is just the tip of the iceberg,
Mm-hmm.
right?
Mm-hmm. There's underlying.
Exactly.
Mm-hmm.
So if somebody has a DUI and they've been caught, how many times did they drive under the influence and not get caught? So anybody who goes to a DUI course, goes to a provider who also provides DUI services, please make sure that your provider is doing a thorough assessment to find out if there actually is a substance use disorder, if there are any other issues that are taking place, because again, a DUI is most of the time
Right.
the tip of the
Right.
iceberg.
And there's probably some mental health issues in there that need to be addressed as well.
Something.
Mm-hmm.
So, once someone enters treatment, it's very likely that a relapse will occur. At least that's what I've learned in the last couple of years. Relapse, for most, is evident. It could very likely happen. Is for the families out there that are seeking treatment for their loved ones and continuing the support, can we share with them like what the road looks like as once someone goes into treatment initially?
So, people that follow the treatment plan have a higher rate of success than people who do not, right? People who are entering treatment need to follow the treatment plan. If you went to a doctor for diabetes or any other type of malaise or illness, and the doctor said, okay, you need to take this, this, and this, you need to do this, you need to cut back on what you're eating, and you need to exercise, and if you only did one of those things, which was take the medicine and none of the others, the results that you're going to have are not going to be the best. And it's the same thing with treatment, right? And this goes back to, we spoke about it earlier. People go into treatment, they get detoxed. It's the first time that they've had a chance to stop using, stop having to wake up every day and use something. And they feel amazing. They feel refreshed, right? They start to do some work on
Some
themselves,
self-worth.
right?
Mm-hmm.
Exactly. And people think that that's it, we're cured, right? Effective treatment plans involve what we spoke about earlier, which is engagement in treatment. Please stay engaged in treatment, right? We have resources available to us. not only in this state, but across the country, that allow us to put together 90 days, 6 months, 1 year of continuous treatment, right? And those options, what those options look like are detox, residential treatment, partial hospitalization, outpatient, continued stay with a halfway house, a recovery house, engagement in self-help. And if that's the treatment plan, if you follow the treatment plan, your chances of success are high. People relapse when they don't do those things, when they think that they know better.
So initially, you have to make the call. You have to pick up the phone and you have to make the call. You have to call the facility and let them know of your intentions, that you want to be free of this disorder. And once you make the call, there's an intake that's done on the phone. And once that evaluation is done, you'll come into the facility and they will do an assessment. And that assessment involves what your treatment plan would look like throughout the process.
Well, let's just talk about the person managing an addiction with prescribed medications. And a lot of our focus has been on, adolescents through 20 to 30-year-olds. What about those people that are going to work every day, managing an addiction? They're in denial that they have an addiction. What's the likelihood that that's going to catch up to them and maybe take their life? And what reach can we do to them to help seek treatment?
I think what we've seen is that there is now a very public acknowledgement that addiction does not discriminate, right?
Sure doesn't.
And a lot of times, an addiction starts with prescription medication, and people may be able to lead a functional life, if you will, a life that people are waking up, going to work every day. If somebody has to wake up and take some type of medication, some type of pill in order to get through their day, there is an addiction. Again, this may be by no fault of their own, and let me also just say that even people who are addicted to quote-unquote street drugs, not prescription pain, it's by no fault of their own either. So those people, at what point will your doctor stop prescribing, right? At what point will maybe your opiate that has been prescribed for legitimate pain, actually, what we know now through research is that it actually stops treating the pain after a while and becomes another cause of additional pain, right? So at what point, if your dose keeps going up and up and up, at what point can you say that this is not effective? And I think you pretty much know. You know. And if you're in denial, people around you know. And there is help. There are effective treatments that are non-opiate related for pain. And the same thing goes with, we have and I know not a lot of people are talking about it, but we have a big problem with antidepressants, benzodiazepines. Xanax is being prescribed across the board.
Xanax has become a really serious problem in the school systems as well.
Yeah. And Xanax is a very dangerous drug.
Sorry to cut you off.
Yeah, I wanted to read Tammy's statement. My 28-year-old sister is on the streets right now. She was clean for about 4 years. Now she's on crack and heroin. She admits now that she has a problem, but has every excuse in the book as to why she can't get clean. She's abandoned her 3-year-old daughter. She's staying at the Arundel House of Hope, but still on drugs all day long. Please help. I hear that all too often from parents. So what can we say to Tammy to help Tammy relieve some of the stress she's putting on herself regarding her sister?
Can I just say, hi Tammy, we have the Family Wellness Workshop, and I know I've mentioned it before, but this is a fabulous program. I I happened to be working one day and with the Family Wellness Workshop, and just listening to the conversations and the therapy that was going on in that group, and it actually changed things in my own life. So I would definitely suggest that you contact Pathways and enroll in the Family Wellness Workshop. It's an 8-hour workshop. Breakfast and lunch is served, and everyone that is there because their family member is going through something very similar like yours. So if you have an opportunity to do so, definitely do that. It's a great resource to have.
And I want to sort of build on that, is that this workshop is run by professionals.
Yes, it is.
And professionals who are involved in substance use treatment, mental health, are going to be able to guide family members through the most effective way of working with their family members, like you, who they'll be able to give you tactics, strategies in order to work with your family in an educated manner, rather than you doing maybe what you've always done, which is
enable support.
Exactly,
yeah.
or also maybe push your family member away. Right. So there are effective ways that we can communicate to our family and again become a part of that clinical intervention to get them help. But an uneducated family, please don't try to do it by yourself. Reach out for professional help, and we'll be able to guide you through the process of getting help for your family member.
And like I stated earlier, substance abuse disorder is a family disorder. It touches and it affects everyone that is in contact with that person, or that loves that person, or cares about that person. So everyone needs treatment. May not need to go into a treatment facility for treatment, but just having mental health treatment and knowing how to just take care of yourself and be responsible for yourself as well as the people who you love. That's a very important aspect of that component.
Kesha, I'd like to ask, let's talk a little bit about prevention. One of our themes too is no new users. That's how we're going to get out of this crisis, is people making the choice not to use from the beginning. Can you please share with the audience, our parents, of the children today that are running around on the soccer fields, playing baseball, they're going off to middle school and high school. Share with what are the signs and symptoms that an adolescent might be going to a party on a Friday night and participating, or might even be smoking marijuana from day to day. What, as a parent, what can I see that might be that signal to me that I need to have a conversation?
If you notice that your child is not engaging in life activities like they used to, keeping to themselves, depressed, just not taking care of themselves properly, if you find little things around their room, I'm not going to say not to look through stuff. You are their parent. You have a right to do that. There's so many signs. Then there are physical signs too: the red eyes, the smell, be tired all the time. There's just a lot of symptoms in regards to substance abuse, especially marijuana use. But as a parent, it is so important to educate yourself. Educate yourself about the drug trends in your community. Educate yourself about what the signs and symptoms of the various drugs that are going on in your community. Know the people that your child is hanging out with. Know their parents. Ask questions. And just stay on top of things. If you don't know, you won't know. So, and that's very important. Education is the key. And if we can do this at an early age, if we can talk to our kids and open up that line of communication with our kids at an early age, that knowledge may promote behavioral change, which also affects decision making, which can later on in life say, you know what, I already know the end result of that. That's not something I want to do. And so that's very important.
So let me ask you this: if you were in a classroom with a group of 8th graders, how would you describe the impact on the brain? I mean, your brain health after you start smoking marijuana at the age of 14, day to day, and then you might start popping Percocet.
Wow. So marijuana affects your brain, and marijuana is a hallucinogenic drug. And it affects your brain in a very negative way because it actually slows your processes down. An adolescent's brain is not completely developed until they're at least age 25 years old. So while you're smoking marijuana between now and let's say 13 to the age of 25, you are decreasing your chances of having a productive brain growth. You're decreasing the white matter in your brain, and your thought processes are not as spontaneous or on time. One marijuana joint can decrease your motivational skills, your motor skills by 41%, 2 marijuana joints by 63%. So there is a huge decrease in your ability to function normally, think normally, be productive on a normal basis. And when I say normal, I mean just doing things that are that normal kids would do. You know?
Yeah, and I also want to say the earlier that somebody starts using marijuana through the developmental stage, marijuana can become physiologically addictive. And younger kids can become addicted to using marijuana.
And so look at, if you start using marijuana at 13 and your first initial reaction is to be giddy and laughing and go through all of these physiological changes, after a while those things don't even happen anymore. Your tolerance level starts to change. So where you would smoke a joint and start laughing initially, later on, after using marijuana for a long period of time, that one joint won't make you laugh anymore. It'll just put you in a different state. And your tolerance levels will grow, and you'll need more and more of this drug to feel more and more of the same effect, when actually you're never going to reach that first time high again. So, and that's with any drug.
Carol's asking, does the school system intervene if they suspect a child is using? We don't have anyone here from Anne Arundel County Public Schools, but I think I can offer that really comes down to an independent decision by the adult that observes a child. It could be a phone call to the parent. It could be a phone call to the counselor in the school. Depending upon the situation with the child, if the child is in a crisis mode, that is a phone call to crisis response. Our crisis response teams through Anne Arundel Mental Health Agency, they do respond daily to our school system with children that are struggling. So we have a few more minutes to take questions. Anything else we need to put out there?
Contact information or pathways.
Oh, yeah, Kesha, how about if people want to make a phone call to Pathways?
To contact Pathways, you can dial 410-573-5400. I knew that.
Try that again.
So to contact Pathways, please dial 410-573-5400 and just make the call. It's very important, and it will change your life.
And looking down the road for Maryland House Detox, why don't you tell us about what's to come?
So we are extremely excited about Maryland House Detox. Maryland House Detox is going to be the state's first and only, so the first ever and the only freestanding detox that is not attached to a hospital. It's a comfortable setting, and we're opening it in Anne Arundel County by the end of this year. And basically what we're doing is Maryland House Detox is an avenue into the treatment system here in Maryland. A lot of times treatment starts with detox, and people are in crisis, and we have almost a bottleneck throughout the state at the detox level. So we worked with the state for several years to open Maryland House Detox. First new beds approved in the state in a very long time, so we're very excited. Thanks to Anne Arundel County and everybody in the county and their support and recognizing the need for this. And so by the end of 2017, Maryland House Detox will be open. The website for Maryland House Detox is mhdetox.com. Maryland House is a Delphi Behavioral Health Group facility. At Delphi Behavioral Health Group, we offer residential detox, long-term treatment options across the country, and our website is DelphiHealthGroup.com. Delphi is DELPHI, so DelphiHealthGroup.com.
I also like to offer, our own health department has prevention coalitions across the county, north, south, east, and west. And www.preventsubstanceabuse.org is their site that contains boatloads of information,
Yes.
a parent toolkit.
Yes.
So those parents that are seeking information to educate themselves, that could be a first start. Taking a look at the website and reading what's available. Also look into when the coalitions meet. This is a great opportunity for you as a member of the community to help us combat this problem. I want to acknowledge the International Overdose Awareness Night.
Yes.
That's going to take place August 31st. It's going to be a huge vigil in memory of those we've lost, to support the families impacted by overdose. That's going to be August 31st at Arundel Christian Church up on Aqua Heart Road. And I thank Carol Boyer and Recovery Oriented Systems of Care for taking the lead for making that happen, because it's going to be an outrageous event. It's very well planned out. So thank you to that team.
I believe that event is going to be live streamed
great.
on through several avenues, and I don't quote me. Well, maybe quote me, but I think last year's was one of the largest in the
It was a
country.
great
Yeah,
event.
that is correct. Carol would rubber stamp that.
Yes.
Oh, okay, now Daphne's asking us, are there any methadone clinics in Anne Arundel County? I know the answer to that is yes.
Okay.
There are two offered through the health department, one on Bestgate Road and one on in Bestgate Road in Annapolis, one on Langley up in Glen Burnie off of Furnace, like the Furnace Branch area and Ritchie Highway. And then also there's some other private clinics. And the simple thing would be to Google methadone clinics in Anne Arundel County, and you could come up with those locations.
If I can just touch on the coalitions in our community. Our coalitions in our community they just are a great avenue, a great organization to have. They work very hard on prevention. They work very hard on resources, and it's important also that our community get involved. So we need our community to come out and to support those coalitions and to be a part of those coalitions, because that would make us a part of the solution. So
That's great.
Mhm.
Coalitions are doing great work.
Yes.
It's just that we have to do a better job of patting ourselves on the back and promoting them to get more people to entertain and engage with the coalitions.
Exactly.
Just as a local community member.
exactly.
I want to put a plug in for Not My Child. Not My Child, our next event is going to be at Smyrna Park Library on August 23rd. In addition, we have a planned event September 13th, Breaking the Silence with County Executive Shue and Mayor Mike Panelides at the Greek Orthodox Church on Reaver Road. Now that's September 13th. That is a morning's workshop that we're offering out to our residents, with the targeted audience being our clergy, leadership, and youth ministers, to engage with them on the conversation. And then our third Facebook Live session will take place next Wednesday, August 23rd at 9 a.m. here at the Arundel Center.
Also, hi Liz. So Pathways is having their 25th anniversary coming up, and I just want to say happy anniversary to Pathways. And we will have guest speakers that will talk about substance abuse and mental health, and that will be more in coalition with the youth in our community and our community.
Before we conclude, I want to go back to Sandy's question, back to Maryland House Detox. How would someone gain admission?
So you can actually self-refer to Maryland House Detox. We are obviously working with all the hospitals in the county and the state for emergency services. When people walk into an emergency room, we'll be able to safely detox those people. But people, if you're interested in Maryland House Detox, There will be press releases. We're going to have a grand opening later this year. You'll see it, and essentially you can self-refer. Treatment provider can refer you. Other professionals that you're working with. We'll be working with the county as a detox resource. We'll be working with, Pathways and other treatment providers as well. So you'll be able to self-refer. You can literally call Maryland House Detox on the phone
What's the number for
gain
Maryland
entry.
House Detox?
It's not up
Oh,
yet.
it's not up yet. Okay, sorry.
We don't want a phone number where people can't come yet.
Okay, that makes
but we will be
sense.
open soon.
Right. And to our treatment providers that would like to participate with Breaking the Silence on September 13th, we are putting together a resource fair, and I've done a reach out, but for those of you who are on board with us right now, it's an easy contact me, and you can easily get on board with that program. Again, it's going to be a resource fair to the community. So for those folks who have questions regarding treatment and options, everything from counseling to inpatient, outpatient services.
Are there going to be vendors there?
That's what I mean by
Oh, okay.
providers.
Providers,
That's what same
Okay.
as a vendor.
Okay.
Yes, yeah. So there's really no registration. Well, you do have to register. It's limited space. I'm taking the first 30 providers, vendors that contact me.
Okay.
Okay, here Alice is asking, anyone can get Narcan through the statewide standing order via the HOPE Act? Yes, let's talk
Doesn't
about
Yes.
Narcan. Well, can we talk about Narcan and its importance?
Mhm.
Sure. Oh.
Okay, I'll take it. So Narcan is very, very important. And Alice made a very good point that now you can obtain Narcan through a statewide standing order that you can carry Narcan with you every day.
At any age?
I'm not sure.
I don't know that answer.
Yeah.
No. Good
Okay.
question.
That is a
question.
good question.
It's important. I've had young people, students come up to me and say, this is something that I think that not just adults need to have, because they're the ones in school that are dealing with their friends that are probably going through this issue as well, and they could, save a life.
Yeah, and people who don't know, Narcan is essentially a way to reverse the effects of opiates or opioids in the event of an overdose. You can prevent death. You can prevent everything else that comes along with an overdose. Narcan is administered in several different ways, nasally or through an injection, and I think it's very important that everybody now, our first responders carry Narcan now. It's in a lot of other providers, offices, and treatment programs. But it's important that everybody at least be educated about what Narcan is. And if you have people in your life who you suspect of using opioids or are using opioids, please get Narcan, have it around, and educate everybody else around on how to use it.
Even if you don't know of anyone that is using opioids, the idea that you have it, that you can save a life of some stranger just at a bus stop or in a grocery store, that's important
Right.
too.
Our expert on Narcan, Sandy, is telling us that Narcan is not for under the age of 18. So Sandy's a trainer, so that is a correct statement. But Sandy brings up another good point, access on demand, the gaps in service. And I think, David, she's specifically asking about Maryland House Detox. How are you going to reach out? Whoa, what did you do with my question? How are you going to reach out to the parents and loved ones when they need it? And are there admissions on the weekends? Because what we hear is that things slow down after 2:30 in the afternoon, and there's no activity for admissions on weekends. And when someone wants help and is ready for treatment, it has to happen.
Yep. Well, actually, Maryland House Detox, we're going to accept weekend admissions.
Great.
So we've estimated for staff levels to be able to do comprehensive nursing assessment, histories and physicals on the weekends. We're engaged in conversations right now with the insurance companies which is a lot of what, providers want to be able to accept people on the weekends. And a lot of times it's, dealing with the insurance companies, because like we spoke about before, dealing with insurance companies is the reality of how you get treatment paid for. So we're already in conversations with insurance companies to be able to accept people on the weekends. And that's normally the biggest hurdle. So this is going to be, essentially detox and treatment on demand. And that's what we need. Again, it's a all hands-on approach. We need to continue to come up with innovative solutions for this. And that's what we're going to do.
Can you go back up to Jenny's comment there about, Jenny brought up that all our health rooms, our school health nurses have been trained in Narcan. So our school health rooms are equipped if needed. They've all been trained. I also like to do a big shout out to Anne Arundel Mental Health Agency, our crisis response, Jen Corbin, who has trained all our police officers on mental health first aid. That is huge for our county. So Daniel wants us to go back. Earlier we talked about Xanax. He knows a few people that take it with methadone, and the clinics allow it. Question mark.
So
No.
So I can't speak to, and I won't speak to any individual treatment provider, and I don't know if the people that are using Xanax in combination with methadone that is being prescribed at the same place, and I also don't know if those people that Daniel are referring to have disclosed to either the methadone clinic or the other, provider who prescribed the Xanax that they're also on one or the other, right? So I can't speak to that, but I will say that mixing any opiate with any type of benzodiazepine, benzodiazepines are Xanax, is very dangerous. We see a lot of overdose deaths because the interaction between the two, it's not just 2 + 2 = 4, it's 2 + 2 = 10.
And that can be a serious issue.
Yes.
So let me just conclude with, because I'm being reminded that just within the last few weeks, the staff at all our libraries have also been trained for Narcan. So let's take that Narcan back into the community. If you're ever attending any of our Not My Child conversations, the fire department is telling us where people are overdosing. They're overdosing in the subway parking lots, in the McDonald's bathrooms. The public places are being used for people to overdose. Any one of us could encounter someone who needs help. So look at it this way: if you're that person that gets recertified for general first aid, Narcan should be part of the equation. We should now be equating Narcan with that piece for first aid, because any one of us could be in a position where we could save a life. So I hope everyone will think about carrying Narcan with them, because you just don't know.
And the Anne Arundel County Health Department offers training for Narcan, for naloxone training, and Pathways also offers naloxone training as well.
Okay. Oh, actually, how much more time do we have?
Time to go.
Okay, before we go, I want to bring up the Good Samaritan Law. Thank you, Caitlin Hall from the Health Department. The Good Samaritan Law is designed to save a life. And this is for someone who has a medical emergency from the use of anything, alcohol, substances. If you, and this is all ages, for our teenagers and our parents, please call 911. The Good Samaritan Law will protect you from any involvement with law enforcement, and that includes if they're paraphernalia or drugs on the scene. This is about saving a life. So Caitlin, thank you for bringing that up. So with that, we're going to conclude today's session with David and Kesha. Thank you for joining us this morning.
Thank you.
We'll be back next Wednesday morning, August 23rd, 9 a.m. to continue our Facebook Live series. Have a great day.
Have a good day.
Bye.
Bye.